an agreement on what those measures should be and what we should do to put them in place.
Great. Well, thank you very much, President Stewart. We're so excited you're here with us again this year. And thank you again for all the amazing work you are doing for the March of Dimes and March of Dimes does for women and babies. We're going to move on to our
Dr. Ramsey.
We're going to move on to our next speaker, Megan Young. She's going to be speaking to us about Healthy Texas Women Plus program, what you should know. Megan Young is the manager for the HHSC Medicaid and CHIP Services Department Policy and Program Unit Development Unit. In that role, Ms. Young supervises a team of 11 policy analysts and subject matter experts who work on maternal and child health policy and programs, as well as behavioral health policy. Prior to becoming manager of this team, Ms. Young was the lead subject matter expert for the women's health policy in the Medicaid and CHIP Office of Policy and Program. Welcome, Ms. Young.
Good afternoon. Thank you, Dr. Ramsey, for that introduction. So I know we don't have a lot of time for this session. I do want to answer as many questions as I can. So put them in the Q&A box as soon as you think of your questions, and we'll try to answer as many live, and then I'll be working to respond in writing when I'm done speaking. So if we could go to the next slide, please. I'm going to start with a brief overview of our core Healthy Texas Women program, or HTW, as we like to call it. Healthy Texas Women serves women ages 15 to 44 with incomes at or below 200% of the federal poverty limit, who are not pregnant and do not have other insurance. Minors aged 15 to 17 must have parent or guardian consent to apply for Healthy Texas Women. The covered services include pelvic examinations and Pap tests, family planning and contraception services, including LARC, screening and treatment for sexually transmitted infections, screening and medication for hypertension, diabetes, and cholesterol, screening and drugs for postpartum depression, and immunizations. In January of 2020, the Centers for Medicare and Medicaid Services approved the Healthy Texas Women Medicaid Demonstration Waiver, making HTW a Medicaid program. Next slide, please. In 2019, the 86th Texas Legislature passed Senate Bill 750 and also appropriated approximately $13.6 million to create the Healthy Texas Women Plus Enhanced Postpartum Services Package. HHSC contracted with the University of Texas Health Science Center at Tyler and UT System Population Health to conduct an evaluation of services used by women in Medicaid for pregnant women in comparison to Healthy Texas Women program. Additionally, findings from the Texas Maternal Mortality and Morbidity Review Committee informed the service package. On September 1st, 2020, HHSC launched HTW Plus. These enhanced services are available to eligible women in addition to the regular HTW benefit package. We're going to look at the eligibility process, and then I'm going to circle back to covered services. If we could go to the next slide, please. HTW Plus services are provided in addition to the core Healthy Texas Women services for women who are enrolling in HTW following a pregnancy. If a woman meets HTW eligibility criteria and was pregnant in the past year, she can get HTW Plus services. Next slide, please. Women can apply for Healthy Texas Women the same way they apply for Medicaid or CHIP coverage, online, by phone, mail, fax, or at a local eligibility office. Women who are eligible for Medicaid due to pregnancy will automatically be tested for HTW eligibility before their Medicaid coverage ends. They do not need to fill out another application. Eligible women are enrolled in Healthy Texas Women with no break in coverage. In state fiscal year 2019, approximately 84,000 women were enrolled in HTW this way. It's important to note that for almost a year now, we have been extending Medicaid eligibility due to the COVID-19 public health emergency. This means that women are remaining on pregnant women's Medicaid beyond the 60-day postpartum standard coverage period. These women will continue to be enrolled in STAR Medicaid managed care and have access to the full Medicaid benefit package. When the public health emergency ends, these women will be tested for HTW eligibility, and they will not need to fill out a new application to transition to Healthy Texas Women coverage if they are eligible. Right now, women who are eligible for HTW Plus include women who transitioned from Medicaid for pregnant women to HTW before the public health emergency began last spring, as well as women who newly apply and indicate a recent pregnancy. HTW Plus services are available regardless of the pregnancy outcome. Next slide, please. Once a woman is determined eligible for Healthy Texas Women, we mail her the pink card. The top image on your slide shows the standard pink card, and the bottom image shows the HEW Plus pink card. If you'll give me one click on the slide there, that red circle shows you where you can find the HEW Plus indicator on the card. Providers can also verify patient eligibility for HEW and HEW Plus services online or by phone. The HEW coverage period is 12 months. After 10 months, we will reach out with instructions to renew coverage. Women who renew coverage after their 12 months of HEW Plus will transition to the core HEW benefit package. Next slide, please. So HEW Plus benefit package, again, was designed based on an analysis of services used by pregnant and postpartum women in Medicaid, as well as findings from the Maternal Mortality and Morbidity Review Committee. The services focus on treating major health conditions recognized as contributing to maternal mortality and morbidity in Texas, including mental health conditions, cardiovascular and coronary conditions, and substance use disorders. So some of our mental health services include outpatient psychotherapy services, both individual, family, and group, as well as peer specialist services. Our cardiovascular, coronary, asthma, and diabetes services include imaging studies, blood pressure monitoring, testing, anticoagulant, antiplatelet, antihypertensive medication. And here's where you can tell that I am not a clinician as I struggle with some of the pronunciation here. And our benefits for substance use disorder include our screening, brief intervention, and referral for treatment, or SBIRT, outpatient substance use counseling, smoking cessation services, medication-assisted treatment for substance use disorder, and peer specialist services. Next slide, please. And I see there's a question in the chat here. So if you're looking to find the covered services, especially labs, you can look for a list of reimbursable procedure codes in our new Healthy Texas Women Handbook of our Texas Medicaid Provider Procedures Manual at tmhp.com. And HEW and HEW Plus services follow Medicaid policies for those services. Benefit limitations are identical to those in traditional Medicaid, with the exception of prior authorizations. No prior authorizations are required for HGW or HEW Plus services. And reimbursement for Healthy Texas Women and HEW Plus services follows the Medicaid fee schedule. Next slide, please. Our pharmacy benefits are available on our Texas Vendor Drug Program website at txvendordrug.com. And it's important when you're looking at the formulary, remember that women with HEW Plus coverage can receive services that are on the core HGW formulary and drugs, as well as drugs on the HEW Plus formulary. So for example, contraceptives would be on the core HEW formulary, while medications for substance use disorders will be on the HEW Plus formulary. A woman with HEW Plus coverage can get drugs from both formularies. Next slide, please. To provide HEW and HEW Plus services, a provider must deliver one or more of the services available through the program, be enrolled as a Medicaid provider, and certify that they do not perform or promote elective abortions or affiliate with an entity that performs or promotes elective abortions in accordance with state law. We are expanding the provider base to add new provider types for HEW Plus, which includes chemical dependency treatment facilities, opioid treatment programs, licensed professional counselors, licensed clinical social workers, psychologists and psychology groups, psychiatrists, and cardiologists. Next slide, please. This is my last slide, and it has some really good resources for y'all, and I'll leave this up while we answer some questions here. So the email address in bold here is how you can contact me or my team at HHSC at healthytexaswomen@hhsc.state.tx.us. And then there's two key websites for you here, tmhp.com/programs/HTW. We'll have links to our provider manual, instructions on how to complete the HEW certification for providers, and it will also have contact information for TMHP if you have any billing or reimbursement questions or concerns. And then patient-facing information is available at healthytexaswomen.org. Okay, what questions do we have, Dr. Ramsey?
Great, thank you, Megan, for the great insightful presentation. Really helpful for us to hear what the Texas Healthy Women Plus program is all about. Just to start with, can you just comment on the expansion of Medicaid for the moment with the pandemic?
Yeah, so there was federal legislation that grants state Medicaid programs an enhanced federal matching rate if we agree to a certain number of things. And one of that is what we like to refer to as maintenance of effort. So it means that we do not terminate anyone's Medicaid coverage unless they die, move out of state, or voluntarily withdraw from Medicaid. And we also won't move anyone into a lower coverage group. So for example, if someone had pregnancy-related Medicaid, that is a more comprehensive benefit package than Healthy Texas Women. Even though Healthy Texas Women is a Medicaid program, we would keep the woman in pregnancy-related Medicaid during the public health emergency.
I think that's an important message for everybody to hear, that our patients, as long as the national emergency is still ongoing, that they still have their pregnancy Medicaid. I don't think a lot of us know that. So make sure you spread that information out, everybody on the call today. The next question is, the Texas Healthy Women and the Texas Healthy Women Plus coverage is only for outpatient care, or does it include any inpatient care?
It's all outpatient services.
Next question is, what happens if a person needs long-term care related to a pregnancy-related issue?
So I think that's kind of hard to answer from a general perspective. Healthy Texas Women providers would generally refer someone to another program or something like that, but it's going to depend on what resources are available in that direct community, as well as what other programs the person might qualify for based on their needs.
Great, thank you. Next question is, do all moms that have STAR pregnancy Medicaid automatically roll over to Healthy Texas Women or Healthy Texas Women Plus? I work with postpartum moms on STAR and find it's rare for them to auto roll over. They usually have to apply separately.
Okay, yeah, that's a really good question, and it's something we hear a lot, and we've worked really closely with our eligibility department and with our internal data unit to keep a strong eye on that. I know that in past years, there had been some issues that I believe were corrected to get those, what we used to call auto enrollments done. The women do still have to be eligible for Healthy Texas Women. So it's more accurate to say that towards the end of their pregnancy related coverage, we test them for eligibility. That also means that we test them for other Medicaid coverage. So if women are eligible for full Medicaid as a parent or caretaker relative, we would also be testing them for that eligibility. And then if they are not eligible for full Medicaid or CHIP benefits and they are eligible for Healthy Texas Women, they will be automatically enrolled into Healthy Texas Women.
Great, thank you. Next question, what is the age coverage group?
For Healthy Texas Women, for the core Healthy Texas Women program, it's ages 15 to 44. Young women ages 15 to 17 have to have a parent or guardian consent and apply on their behalf. And then for Healthy Texas Women Plus, it's for ages 18 to 44.
Great, thank you very much. Another question, we know that sepsis is a big contender for maternal mortality. Is this not covered by the Texas Healthy Women Plus program? What if a mother needs to see an infectious disease specialist, possibly for an infected abscess due to mastitis?
Yeah, that's a great question. So Healthy Texas Women does cover unlimited office visits. So some type of initial consultation and would be covered. Any type of specialty care that's not part of our covered procedure codes would have to be covered by some other program or way.
Great. Another question, behavioral health services, who would qualify as a peer specialist?
Sure. So the best place to get information about that is going to be in our Texas Medicaid Provider Procedures Manual and our Behavioral Health and Case Management Handbook. It has a full description of the peer specialist benefit and instructions on how people can enroll. But they have to get a certification through HHSC through our Behavioral Health Services Department to be able to bill for Medicaid peer specialist services or HCW peer specialist services.
Great. Couple of questions, I'll nest these together. How many women have utilized the Healthy Texas Women Plus program so far? And have we received any feedback from the state about their experiences?
Yeah, so we have about an 8-month lag on seeing accurate claims data. So since the program has only been up for about 5.5 months now, we don't actually have claims data that we're able to analyze yet, but that's definitely something we're going to be keeping an eye on in terms of monitoring utilization of services.
Next question is, how are Healthy Texas Women and Healthy Texas Women Plus providers vetted?
I don't know if I understand how they vetted. All the providers have to enroll to meet our Medicaid requirements through TMHP. So there's I'm sure many of you are familiar with the Medicaid enrollment process. And then after that is done, they just have to certify compliance with state law, meaning that they don't perform or promote elective abortions or affiliate with entities that do.
Next question is, will this cover doula care services?
Doula care is not a covered benefit in Medicaid or Healthy Texas Women right now. I can say that that's something that we're researching right now. We have received stakeholder recommendations for the Medicaid program, and we're working on developing some processes where we are considering when something is recommended for Medicaid that could also be a benefit for Healthy Texas Women, to do that research and determination of coverage at the same time.
Thank you. Can you discuss what's available for undocumented patients who are on CHIP?
For our CHIP perinatal program?
Yes.
Yeah, the CHIP perinatal program covers prenatal care and labor and delivery services for women who are at or below 202% of the federal poverty limit. We know that about 99% of the program is women who are financially eligible for Medicaid, but who don't meet the citizenship and residency requirements of Medicaid. And since for CHIP perinatal, the coverage and the definition under federal law is for the targeted low-income child from conception to birth, it's based on the child meeting that requirement at birth. And so we provide coverage for that prenatal care through our CHIP program.
Great. Next question is, why does the Healthy Texas Women Guide say if a person needs more extensive services, you will provide them a referral and they may have to pay?
Yeah, so if services aren't covered by the Healthy Texas Women program, and then we could refer out to other kind of community organizations. But HHSC, since we don't operate those programs, we couldn't really speak to whether payment would be required. But it is a possibility depending on what resources are available in the community.
Great. We have time for a couple more questions. And thank you for being so patient. Obviously a hot topic and we'll obviously get these answered. Any we do not address will get answered in the FAQ after the summit's over with. I understand that providers who are already credentialed to take Medicaid can participate in the program. However, what is the sense in the number of providers that will be participating, and will women be able to find the right type of person, example, cardiologists, that will be willing to take patients, Texas Healthy Women Plus coverage?
Yeah, so we look at our provider base every fiscal year, and for fiscal year 19, which again is before we rolled out Healthy Texas Women Plus, we had a little over 3,000 active providers in our Healthy Texas Women program. So that's our providers who had a paid claim in that fiscal year. And so in terms of how to find those specialty providers for the Healthy Texas Women Plus services, we're working on a way to update our online provider lookup on the healthytexaswomen.org website to include searching by provider specialty. And in the meantime, we've also we've turned back on the online provider lookup at tmhp.com. So the same lookup that is used to find Medicaid fee-for-service providers, you can also search by Healthy Texas Women there. And that has a little bit more readily available information in terms of provider specialty.
There's a question. My social worker mentioned that some women that were covered by COVID extended pregnancy Medicaid have lost their coverage in the last few weeks. She thought the COVID extension must have expired. Can you confirm that that's not the case?
No one should be losing coverage. And again, if someone wanted to send an email, we could look into some specific cases. I could refer that over to our eligibility department. They may be thinking that some women may have gotten some letters to provide some information in the event that when the public health emergency ends, so that we do have up-to-date information to verify client eligibility moving forward. So they may have gotten something in the mail to verify some information or notify them of a renewal, but no one should have lost coverage. And so if you are seeing that your patients are losing coverage, please do let us know.
Great. Well, thank you very much, Ms. Young, for your really insightful responses to these questions and this important information for all of us to be aware of. There are lots of questions in the chat box. I apologize if we didn't get to your question, but we will get those answered and have those posted on the collaborative website. So again, thank you very much. And at this point, I'll hand it over to Dr. Savani to roll us into the next session.
Thank you, Dr. Ramsey. What an exciting presentation from Stacy Stewart, and then how informative, Megan, you were. Thank you so much for that. I'm sure it's not lost on anyone that our lives have been turned topsy-turvy.